Where's the center of global health? Is it Geneva? Is it London? Actually, it's Seattle. And we're going to have someone here who's going to be talking about why it's Seattle, and she is Lisa Cohen of the Washington Global Health Alliance. Lisa, welcome.
Thank you very much. So we're a consortium of the major global health organizations in Washington State and beyond, but mainly centered in Washington State. And we created the alliance so that we could leverage the expertise and skills of the various organizations that are here. We believe in Washington State we probably have the greatest concentration of talent and skills and expertise, from discovery, development, and delivery to commercialization of new global health approaches, whether it's technologies or programs or whatever that might be. And so we want to figure out ways to partner so we can have greater impact.
Why is it that there is so much global health in Seattle?
What people often don't realize is when you think global health in Seattle, often people think of the Gates Foundation, which has been astounding, of course, and the impact there. But they're relatively new, and actually our global health roots in the Northwest here go back more than 30 years. PATH and Seattle Biomed, the University of Washington, Fred Hutch have all been working on these issues for more than 3 decades. And I think that there are a few reasons for that. One is we're more pioneers. We're more willing to take risks. We're willing to fail, and not as tied in with some of these centers, traditional centers like New York or Boston or DC. So I do think there's this culture of risk-taking. And the other thing is that we talk about a lot is a willingness to partner. And that isn't true of necessarily every place else, not only in the United States, but in the world. But people who you might think of as competitors in one sense are willing to get together around the same table. And then the third is we have this culture of compassion. People are really dedicated to solving some of these issues and figuring out sustainable ways to address these problems of disparity.
But why Seattle? It's so far from everywhere.
That's part of the reason. I think that's exactly part of the reason is because it's far from everything, far from many places. But the other thing, when you talk to the leaders who are here, the people who are really doing the work, at the beginning it was that there were people who are willing to take these risks that I talked about. Now we have this campus of activities, and because we're willing to partner and collaborate, that's drawing more people who want to work together.
I just want to make sure that everybody knows we're going to be getting the website up several times. This is just the front page. It's a very deep and broad website. Go to WGHalliance.org, and of course it's up on the screen. Before we get to other parts of the world, I want to stay home because there is a report that's out just from April of 2012. By the way, as we do the show, it's May the 1st, 2012. So some of the things that you hear may have already happened by that time. But this is a report from April of 2012. And it talks about a study that's done, and the headline is Girls Born in 2009 Will Live Shorter Lives Than Their Mothers in Hundreds of U.S. Counties. This isn't Kenya or Tanzania. This is U.S. counties. And here's a quote. It says, in 661 counties, life expectancy stopped dead or went backwards for women since 1999. By comparison, life expectancy for men stopped or reversed in 166 counties. This troubling trend is occurring in 84% of Oklahoma counties, 58% of Tennessee counties, and 33% of Georgia counties. And certainly those 3 states are kind of are poor states. How can that be happening in the United States?
Well, that's one of the complete misconceptions that we have, is that we have just got to be, because we have this expensive healthcare system and we are this industrialized society and a so-called first world country, which is a complete misnomer, as you know, that is that we must be healthier. And yet that is not the case, obviously. And not only in this case, if you look at our rates of prematurity and stillbirth, the United States is way in the middle of the industrialized countries. And I always like to quote David Fleming, who's our brilliant public health officer here in Seattle and King County. And he says that he can tell you someone's health outcomes by their zip code. And because if we ignore the the people's broader living conditions. Health is a function of many things. So it's not only the care, but it's also our access to nutrition. It's, can we get on a transportation line? Can we have access to not only physicians, but dental care, all sorts of things. If you don't feel well, you can't go to work. And whether you have malaria or whether you have flu or terrible tooth decay, I mean, it can be all sorts of things. So we shouldn't just put these things in silos the way that we talk about them. Health is not only, it's a physical condition, but it's also about our entire community. And so that has to do with what our education is, as I say, our access to grocery stores and fresh fruits and vegetables, our access to care, and what we can learn from these sobering statistics about the United States. We can learn from the global health community because they've learned to work in resource-constrained settings and make a lot of progress with thinking about this issue from a holistic standpoint.
Well, we're not going to get into political matters so much, but it definitely is always a political issue. Every single election that there is on a national basis as to the expenditure of U.S. tax dollars in other countries. It sounds like what you're saying is that at least research dollars that is spent on other countries actually is having application here at home.
It absolutely is, and actually I appreciate the opportunity to comment on that because people think that we give a lot of money to other countries, to international aid, and yet it's a fraction of 1% of our GDP. So it is a very small amount. The United States is the most generous country in terms of aid, and we are learning ways. What's really important is for us to figure out what works and what doesn't, which is why the authors of this study that you were talking about, who are out of the University of Washington, the Institute for Health Metrics and Evaluation, why it's so important to gather this data and learn what the reality is rather than just what our impressions are. So we find out that our health outcomes here in the United States aren't so good, or so that we can learn and see what's working in whether it might be in Kenya or whether it's in South King County in SeaTac and Tukwila, what is working and how can we leverage those opportunities, have better impact.
Well, let's talk about some of your work. We're going to go to the website in the About Us section, actually, because one of the first things that you say is that you align partnerships. How do you do that? What kind of partnerships?
So this is the coolest thing about my job. First of all, I feel like I'm the luckiest person in the world. I do not have a background in global health, and yet I've been completely inspired by the people who've been working on this for so many years and dedicated their lives to solving these issues and addressing them through times of great hardship and very little funding until recent years. We hear a lot more about global health now, but we sure didn't as recently as 10 years ago. So to me, the opportunity to find partners that are non-traditional partners. For example, there's a camping company here in Seattle who makes products for the Thermarest and the Platypus water containers and things like that. And a couple of their engineers stumbled upon an idea for water filtration, because you need that as a camper, right? You need to be able to filter the water out of a stream, and they came up with an idea, and they said this might have some applicability in the developing world for people for whom cholera is such a scourge and so many diarrheal diseases and other things. So we've talked with them, and they also talked to PATH, one of our key members, and they created a beginning of a partnership, but we've enhanced that partnership and connected them with all sorts of other organizations. So here's this for-profit company, but who with this interest in the developing world, with a few people, just 2 or 3 people at the company who started this, and now it's just blossomed. The other thing that we do is we help people know what's going on with their partners and sometimes even within their own organizations. For example, the universities, both of our wonderful universities, the University of Washington and Washington State University, do work in dozens of countries around the world. But a lot of times they don't know that the other one is there, or even that one of their departments is there and another department is there. And for example, the business school might be there, and the global health department or public health or dentistry. And we help them all know that they can work together. And
so you merged bureaucracy?
We merge bureaucracy. We actually, what we say, we try to break down silos. I mean, ours is all about leveling the playing field. One of the really exciting things we're doing now is we're working with the Seattle Sounders, who came to us and said, we're interested. You know, a lot of our players come from the continent of Africa and
Just a moment. For those who don't know, the Seattle Sounders is a soccer team, right?
yes, a professional soccer team. I didn't imagine that anyone wouldn't know who the Sounders are, but yes, thank you. They came to us and said, we're interested in developing something. So we said, what if we use soccer as a magnet in a developing country? And we brought in some of our partners, PATH, the University of Washington, Fred Hutch, others, Fred Hutchinson Cancer Research Institute, and look at what they're doing already. But we use the soccer as a magnet. So you build a field there, get kids to come, and then we can get them either vaccinated, or we get their mothers checked, or their animals checked for disease. And you know, we can leverage again the opportunities and the partnerships.
So in the partnerships that you aligned, it sounds like you also align agriculturally as well?
Absolutely, absolutely. You cannot do this without nutrition and safe water and clean water. I mean, and that's, I think, what we're seeing more and more, whereas before you heard about AIDS and HIV or TB or malaria or the other things, or cholera. Now we recognize that for cholera, obviously you've got to have, it's an issue of clean water, right? I mean, this has been such a huge issue for Haiti, and killing so many people. And so we need to think about clean water. You also have to think about, you know, healthier kids are going to be more resistant to disease often. Mm-hmm. So you need to have access to cassava and, you know, ultra nutritious rice and things like that that many of our partners are developing. And
wow.
So it's all tied in together.
We're talking with Lisa Cohen, the Executive Director of the Washington Global Health Alliance. Educating new leaders. Yeah. That is something else. Are you an educational organization?
We are. Absolutely, we are an educational organization. I mean, what we're trying to do is help people understand the relevance of global health and the research and development and the programs for our own lives. But the other tremendously exciting part of this is that young people are just clamoring to get involved, and you're familiar with this as well. But we have the University of Washington's Department of Global Health is the fastest growing department on the campus, and we have whether they're business majors or pharmacy majors or nursing or research scientists or communications majors, journalism students, they're global citizens already, and they want to be involved. And so it's the young people who want to figure out how to get engaged, whether that's as a career or just to feel that they're doing something better. It's also people my age who have been very fortunate and had a good work life and want to feel that they're giving back. And so they're looking for ways to engage as well. So we've developed, one of the things we're proudest of is we've developed a global health high school curriculum that is in 73 schools across the state at this point, and it's a math, science, and social studies curriculum. So kids go from their algebra class to their chemistry class to their social studies and history class, and they're learning about why mosquitoes don't want you to know about climate change. Or you're a World Health Organization official and somebody on a plane has drug-resistant tuberculosis, something we heard about a few years ago, a case. What do you do? How do you vector out who has to be isolated? So it's real-world sorts of problems. Or
this is high school students
This is high school students.
Wow, how many thousands of people do you have that work for you?
We have a huge staff of 5. I mean, they are all energetic and passionate, and so it's so exciting to see people, you know, to see these kids get engaged, do projects, learning how to make soap to combat cholera and things like that.
So this all comes out of these aligning of partnerships through the Washington Global Health Alliance.
Yes.
Wow, and all of these different groups that are based or somehow have a presence in the Seattle area are doing these things.
Yes, yes, and we're so proud, and people come to us with ideas all the time. And my great regret is that we can't do everything that people have fabulous ideas. So it's a question of capacity. And, but we have the ability, you know, the organizations are also doing their own educational outreach programs, you know, PATH and Seattle Biomed, Fred Hutch, Infectious Disease Research Institute, Seattle Children's Hospital and Research Institutes. And so they do that, but we are able to look at this from a 30,000-foot level and say, okay, here are some ways that you all might be able to coordinate and have an effective, leverage your effectiveness more importantly.
We've got so much to cover, but I gotta ask this. I mean, Chicago is an absolutely great city.
Yes.
And there are other great cities in the United States. Dallas is a great city. Phoenix is a great city. And certainly if you go up and down the eastern seaboard, fantastic cities with great educational institutions. But they're not doing this. And it's not a jealousy thing or it's not a competitive thing, but I'm just kind of curious as to why it's, again, coming back to the very first thing. Is it truly that entrepreneurial, devil-may-care attitude that seems to permeate this entire area?
I think so. Atlanta has been a real key center for global health, and we wouldn't say we are the center. We would say we are a center, and because it's a partnership, right? And I always say, you know, there's room for everybody because there are lots of issues to be addressed. But that said, you know, the Gates Foundation absolutely, you can't understate, as I said, their impact on this. But I think it's not only that entrepreneurial spirit, it is that willingness to sit down literally at the same table together. Our executive members, the CEOs, get together from the Gates Foundation through Site Life and the Infectious Disease Research Institute, which are smaller organizations, get together quarterly. And they're traveling hundreds of thousands of miles a year, and yet they come together and we share ideas about how to address these things together.
Tell us exactly what your approach is to galvanizing involvement.
Well, one of the things that we've done is try to educate the economic sector and our political leadership about the impact of this sector. It creates good jobs, a lot of jobs, and people feel good about doing it. So, and as I already talked about that interest by the young people. So we have tried to address this in a few ways. One is to identify this as a sector that deserves some attention and recognition. It's a point of pride for this state. Secondly, and in the most exciting ways, I think that we've reached out to young professionals and young emerging leaders. And one of the things that we're doing is, it'll be our third year this year, is an event for young professionals to come together around a purpose. And it's called Agency. And it was originally called the Party with a Purpose, but we found out
Party
that
with a
was
Purpose?
Party with a Purpose.
Hey, I'm there.
And that's exactly, although we would be in the elders group, which is, I got to go, so it's great, and you can go. But the first year, we had room for 550. It sold out 2 weeks in advance. And it was a chance for young people to get dressed up and come to an event to learn about global health issues. And the first year was all around addressing diarrheal disease. And
you know, I got to tell you, I never would have gone to a party for the sake of learning about diarrhea. How come they are today?
Because they're connected globally. I mean, I do give technology credit for this. I mean, people, the boundaries, we think in terms of borders still.
Yeah.
And we think about, is the U.S. better than everybody else? But we are so much stronger if we are operating together, right, in partners. And these young people get that. And
when you say young people, what age group?
This is 20s and 30s. So, and as I say, 550 sold out the first year. Last year, more than 1,000 the second year. We'll have more than that
Oh my
this year.
gosh.
And we have to turn people away at the door. And they're selling their tickets on Craigslist. And last year, it was all around TB diagnostics for Haiti, development of that. This year, it's about a mobile application for pregnant moms in Timor-Leste. And it's a volunteer group of young professionals from Microsoft, Amazon, some global health organizations, graphic design organizations, event companies, and they come together and they vet. Man, they make these people apply and they vet these very carefully and all the projects, and then they showcase not only the project that's winning, but all of the Alliance executive members. But what they say is, you come to this big party, you've got this terrific young potential donor base getting involved, and it has to be interactive. You can't sit at a table with a bunch of your papers and hand out your pamphlets to us. It's got to be something that you engages us and gets us involved. And then they've involved the arts community. They have a call out for artists who interpret what the projects are for each of the organizations.
Wow, that's fantastic.
Showcase.
So while they're communicating locally,
Yeah.
are they also communicating globally?
Yes, yes, they are. I mean, most of that is done through social media. In fact, this whole thing is done through social media. So there's never been an advertisement or anything like that for agency. It is all done and promoted beyond
Wow,
Seattle.
tremendous. Well, let's go to some of the other involvements that you've galvanized. Let's go to the global to local.
Great.
What exactly is that?
That is applying global health strategies to reduce health disparities at home. So again, that was taking advantage of the expertise that's here in the Washington State area. And a Swedish hospital and medical center, one of the healthcare operations here in Seattle, a large one, came to me a few years ago and said, listen, we know that we need to learn more about healthcare delivery and delivery of not just of healthcare, but of health. We think we have something to learn from your members. So we convened a dinner, and we had the Nobel laureate head of this, Fred Hutch. We had the head of PATH. We had the head of public health and all sorts of people. And it was just a fascinating conversation when the president of Swedish said, what do you think we should be doing? And the scientist, the Nobel laureate, said, you need to think about genomics. You need to be thinking about in terms of, genetics and all sorts of things. And the conversation went around these very scientific things. And finally, the head of PATH said, I think you need to think about improving immunization rates and getting right down to basics. What we did was identify a very high needs community here in King County. In King County, where Seattle's located, we have the worst disparities in wealth in the country. The chasm between the haves and the have-nots is horrific. So at the airport area where SeaTac Airport is, we have 180 languages spoken in that area, and no health clinics, one grocery store. So we've been working with, we partnered with the public health department, Swedish, and a community health provider. But what we learned was what the global health folks, what we said was you need it to be a partnership with the community. We can't parachute in and say, here's your answer. This is what you need to do, and here are the techniques and tactics.
It's because healthcare is personal.
Well, it's
There's
not
nothing-
only that, people are personal, right? This is a different culture. This is, you can't come in thinking you have answers without asking them what they need. So we thought they needed a clinic, but they said, no, that's not. We need translators. We need community workers out helping us in the community. We need mobile technologies that are going to help us. We need access to fresh fruits and vegetables. That's higher on our list than a very fancy clinic.
So in an area that is among the wealthiest in the, that is near among
Right.
the wealthiest in the United States,
Right.
has no difference than an area perhaps in Tanzania.
It could be, yep.
Wow.
Yeah.
Global Health Nexus, what's that?
That is another way that we're engaging with the broader community, and this is really inspiring. This year is the 50th anniversary of the World's Fair, of the Seattle World's Fair, and if you hadn't marked it on your calendar. And we had business leaders come to me about 3 years ago and said, we think that what sets us apart now, one of the key things, we've got aerospace and coffee and Microsoft and things, but is global health, and that's something, a point of pride, as I mentioned. So they said we want to have the month of July be Global Health Month. We've developed these working groups. We have more than 200 people who've been working for 2 years on developing exhibits and events and all sorts of things. It's going to be amazing through the months of July and August here at Seattle Center.
Wow. I grew up in Knoxville, Tennessee. If a group from Knoxville, Tennessee were to call you and say, can you help us do what you've done here? Can you help us do this in Knoxville? What would you tell them?
Absolutely. This is supposed to be replicable, right? This is supposed to be, if we can create these pockets of collaboration and innovation, we need it. We've done it, actually. I've been working with the Research Triangle to help them create an alliance there, and worked with Queensland and Australia. They've been talking with Toronto about it.
Lisa Cohen from the Washington Global Health Alliance is with us. The website, we've had it up on the screen several times, but there's one part of the website you got to go to. It's the calendar. And of course, while the calendar may be for events that are local to your area, my goodness, there's a ton of events on there.
Yeah, but that's because people, not only are these organizations doing the work internationally, they're also educating each other and the general public here. So they do things like trivia nights, or there are lecture series, or it can be engagement. I mean, the more that you can know what each other is doing and then let everyone know so they can pick and choose. So we try to be a clearinghouse for all those. We don't do a bunch of events ourselves. We do some high profile, brought Paul Farmer in and we're doing a Melinda Gates event in July, but we like to highlight what everybody is doing. So if you're interested in these types, in any subject, and it could be the most scientific subject to thinking about nutrition or how do we empower girls and women.
We've talked an awful lot about the great things that you do. I don't want to talk about failures, but are there some successes yet to be?
There are many. I would say this is incredibly humbling at the same time as it's exciting. I mean, if you work in global health, I think you have to be humble because the challenges are so great. So we can brag about the tremendous work that all these organizations are doing, but for the progress being made, there are always heart-wrenching, heartbreaking disappointments.
Well, there have been huge progress in malaria.
Yes.
Which, an incredibly debilitating, one of the most deadly diseases on the planet.
Right.
That's happening now.
You have to look at it in increments. These are long-term problems. TB has been around, since the dawn of humankind, practically. So it's an ancient disease. And so you have to think about, these are incredibly complicated to solve. So we're fortunate that we have vaccines for measles or polio or other things, but to come up with the vaccines for HIV, for figuring out how to filter water so that people aren't, dying of diarrheal disease. I mean, that's one of the top killers of kids. And how do we get the polio vaccine to those last 4 endemic countries, and really truly eradicate it? So these are huge problems, and yet you have to take heart in the dedication of the people involved. In the more we're learning about partnership, we're becoming more and more sensitive to that, and the willingness of funders like Bill and Melinda Gates and Warren Buffett to step forward. And also, I just appreciate that they're throwing the gauntlet out to other people, saying, this is how you measure your success, right? I mean, what better, when I think about Seattle, one of the things I'm proudest about, aside from the Gates Foundation, is what Bill and Melinda have done about saying it's not about how many houses you have, it's not about how many cars and all these material things, but what will your legacy be? And for Seattle and Washington State, I hope our legacy will be that we've helped address and made tremendous, real significant progress in making people's lives healthier.
Well, with that, the clock has come to an end for today, and thank you very, very much with what you're doing there. Lisa Cohen from the Washington Global Health Alliance. Strongly encourage you to go to the website. Again, it's deep and it's broad, and you're going to learn an awful lot. And hey, maybe you want to party with a purpose too, right there through the Washington Global Health Alliance.